Ms. Mancini. I'm a level 2 student nurse. I'm going to be the student nurse taking care of you today. So I do understand that you have had surgery 2 days ago, and the doctor has written to put an indwelling catheter in you. So the size of Foley catheter that we're going to be using today is a size 14. So most adults use either sizes 14 to 16, but we want to use a smaller diameter so that it decreases your chances of any urethral trauma. So the reason why we're doing indwelling catheter today is because it will remain in place until you're able to voluntarily and completely void by yourself. So Ms. Mancini, before we get started, I'm just going to ask you a few questions on your past medical history, your allergies. So do you have any allergies to latex or rubber products? And any allergies to antiseptic solutions? Okay, and what about water-based lubricants? Perfect. So before putting in the catheter, I'm just going to be palpating your abdomen region to check for distension. So I do notice that there's distension in the lower abdomen region. Ms. Mancini, if I could just take a look at your wristband, and if you could just verify your name, your date of birth, and your hospital number. Perfect. So Ms. Mancini, I'm just going to be placing a waterproof pad underneath you, so if you could just scoot up just a tad bit. Perfect. And we do understand that you have 630 milliliters of urine in your bladder, so we want to help you void that and make you feel at more ease because you are experiencing abdominal pain at the moment. So now I'm going to be grabbing my equipment. So the 1.5 inches of the outer layer is considered contaminated. So since I don't have my gloves on yet, I'm just going to be touching that area. So right now I'm going to be positioning you in a dorsal recumbent position. So you're lying on your back, which is great. So if you could just flex your knees and relax your thighs outward, so it's kind of like a butterfly. Perfect. So now I'm going to be grabbing my drape, and I'm going to drape my patient. So this is the shiny part, which goes under. So now I'm going to go ahead and place my gloves on my hands. So now I'm going to be locating your urinary meatus, so if I can just get you to cough so it can make it easier for me to locate it. Perfect. So now I'm going to be grabbing my towel, and I'm going to be wetting it in soap and water. And I'm just going to go ahead and clean her perineum and her labia, starting from the clitoris to the anus. So now I'm going to go and put on my sterile gloves. So again, I'm maintaining my sterile field by just grabbing the 1.5 inch layer on the outside. So now I'm going to go ahead and place the sterile drape over you. So now I'm going to go ahead and lift my sterile tray and place it between my patient's legs. So now I'm going to go ahead and find my lube. So it's just located right here. I'm going to tear it. I'm going to dispose it into my sterile field, sterile container. Okay. And now I'm going to be taking my antiseptic iodine solution, and I'm just going to be pouring it over my cotton swabs. So now I'm going to be opening my catheter. And I'm going to be dipping 1 to 2 inches of the tip of it into the lubricant. So now I'm going to grab my tongs and grab a cotton swab that I just dipped with iodine solution. And with my other tongs, I'm just going to wring out the swab. Perfect. And now I'm going to go ahead and with my non-dominant hand, separate the labia and clean around the meatus. So now I'm gonna, each time I change direction, I change my swab. So I do this approximately 3 times. So I'm going from the clitoris to the anus, cleaning the meatus and the labia. So now I'm gonna be attaching this bag to the catheter so that when your urine starts getting voided, it goes directly into the bag. So now I'm going to be testing out my balloon, seeing if there's any leakage or if the catheter is intact. Perfect. So now I'm going to be grabbing the catheter from 10 centimeters from the tip, and I'm going to be putting it in the urethral meatus. And slowly putting it in until I see urine output into the bag. So now that I do see that urine is flowing, I'm just gonna put it in another 2.5 to 5 centimeters more until I feel resistance. So now I'm gonna be grabbing my liquid, and I see that it is full, 10 milliliters. And I'm just gonna be placing it here and gently squeezing the liquid. And this is now forming a balloon, in her bladder so that the catheter is able to stay there. So now I'm gonna be letting go of my syringe, and I'm just gonna be pulling it until I feel slight resistance. Yeah, so now I know it's. So now I'm going to be applying a new set of gloves, clean gloves. And I'm just going to be taping the catheter onto your thigh so that it is in place. So now I'm going to go and grab the bag and be placing it below your bladder on the bed, on the side of the bed frame. So now since I removed my gloves, I'm going to be washing my hands with soap and water because I was in contact with bodily fluids. Ms. Vincini, do you have any questions or concerns? Any discomfort now? All right, great. I'll be back soon. So I'm just going to be removing this waterproof pad underneath you. So removing the catheter itself won't be that painful. You may just feel it coming out. And you just let me know if you're experiencing any pain, okay? So now I'm going to go ahead and place this waterproof pad again underneath you. So if you could just scoot up for me a little. Perfect. And again, I'm just going to have you in the dorsal recumbent position with your knees flexed as well as the thighs relaxed facing outwards in a butterfly position. So now I'm going to be putting on a new set of clean gloves. I'm just going to take the tape off and disconnect the catheter, but it's still flowing in the bag. So I'm going to be placing this drape over you, and I'm going to be grabbing my towel. And just wetting it with my soap and water. So now I'm going to separate your labia, and I'm checking for the meatus, and I'm checking for any inflammation, redness, or signs of trauma. And now I'm going to go ahead with my towel and just clean around, starting from the clitoris to the anus. I'm going to begin by cleaning the catheter and working my way down. So now I'm going to be removing the fluid that's in her bladder back into the syringe. Since I know that 10 milliliters is inside, I should be expecting 10 milliliters to come back out. So I'm going to be placing it right here and just slowly and gently So now I'm going to be slowly and gently removing the catheter. So now I'm just taking a look at the catheter and making sure that there is no balloon or that the catheter is still intact, and it is. Now I'm going to go ahead and measure the urinary output that she voided in the past 36 hours. So now I'm just going to remove the waterproof pad. I'm going to remove the drape. So Ms. Mazzini, do you have any questions or concerns? Okay, so now that your catheter is out, if you ever have the urgency to urinate, you go to the bathroom. And again, if you feel distension again, you can let your physician or the nurse know, and we can always put in another indwelling catheter again. So now I'm gonna wash my hands again with soap and water because I was in contact with her bodily fluids. So.